you guys, me Adam Deshaun with another video. So this video we're going to be talking about toxic and nurse bullies, right? So let's talk about the first one. Let's talk about toxic nurses. What do I consider a toxic nurse? Now, there are several different personality traits that make you a toxic nurse, and you need to and I encourage everybody to self-evaluate to see if you're a toxic nurse, right? The first toxic nurse I want to talk about is that very high strung, very like hostile, very, if one little thing goes wrong, then like everything is wrong, like that type of nurse. I think that's toxic. I think that's toxic to the work environment. I think that's toxic to the unit, and it stresses everybody else out. I'm more of like easygoing. I'm gonna do what needs to be done, but everything is not an emergency. If that makes sense. Like, everything is not an emergency. This nurse thinks everything is an emergency. And it makes the whole unit hostile. It makes the environment really, like, hot, very intense. I don't like working with this nurse. The second type of toxic nurse is the nurse that is always gone. Like, gone all the time. Like, she does a med pass, or she gets somewhere and she hides, or he or she, or is basically leaving the rest of the units to pick up the bag with her patients. I don't like that type of nurse. That is a toxic nurse. That is just annoying. That's annoying to me. Another type of toxic nurse is a negative Nancy. Like for me, I'll come into the unit. I typically come on to work with a positive attitude. Typically. Regardless of what type of day I'm having, what type of night I had, I typically come onto a unit with a positive, just outlook on the shift. But this nurse will come on, like, let's say we're down a tech or a nursing assistant. You know, she automatically thinks it's the end of the world. With me, on the other hand, I'll look at the techs we have and I'll say, oh, well, at least we have, you know, tech so-and-so, she's an awesome worker, she's a team player, she helps, blah, blah, blah. But instead of looking at the negative aspect that we're missing the tech, look at the good tech that we do have, right? So that nurse is kind of like, just like, everything's not negative all the time. Like, have a positive aspect. Now, let's transition over to the nurse bully. Don't like this girl. Don't like this dude. Don't like this type of nurse. Now, I think a lot of you guys have heard the term nurses eating their young. So what that means, and this is the type of nurse bullying, is basically a nurse that diminishes and degrades another nurse for their lack of knowledge, for their noviceness, being new to the unit, or also being new to the nursing field altogether. Now, a nurse bully, a typical behavior from this nurse bully, and I see this one all the time, is like, let's say you come ask a question, and that nurse will look at you like that's the dumbest question in the world. Like, how dare you ask me such a stupid question? That's nurse bully behavior. Another thing is, if you're new to the unit, let's say, and nurse bullies love new grads. So new grads, if you're watching this, be mindful of the nurse bully. Right, be mindful. Because what they'll do is that they will completely diminish you and tear you apart for making either a small error or just not knowing some information. And some other things that they'll do, instead of, let's say they find a small error in your charting. Let's say you made an error on something at the bedside, like maybe you didn't label something, you didn't date something, or you might have said something or did something that may not have been the right way. But instead of them, they'll either come to you with a very diminishing, a very passive aggressive, very patronizing way, versus just saying, hey, next time maybe you could do it this way, or this is our facility protocol. Or this is another thing I don't like that people do, nurse bullies do. They will take what you've done and announce it to the entire unit. Like, they'll have, like, come look and see what so-and-so did. Come look at this note that so-and-so wrote. Come look at this. And, you know, that's just real messy. That is patronizing. It is hostile. I don't like that. It's degrading. That is some nurse bully type shit, and I don't like that. So how do we get over this? How do we change the overall climate of the unit when you have these toxic nurses and you have these nurse bullies? Now, the toxic nurse, these behaviors can be addressed. Let them know that these things are not going to be tolerated on the unit. Far as like the nurse, like I said, the nurse that is hostile all the time. I had this situation the other night at work. What was going on with the patient was not life threatening. Like it was just like, but she was running around like the world was about to end. So like I was, let's say her name is Ashley, and I stopped her, and like I could tell she was walking up on me, getting ready to make my anxiety tap in. So I said, Ashley, stop. What is the problem? Okay, let's take a breath. Let's take 5 deep breaths. Literally stopped her. I said, what is it? Is the patient coding? Is the patient, are they, do we need to call a rapid response? Like, what is going on? She's like, no. I said, okay, so stop. Take a breath. Tell me what's going on. And that's going to train her to also be mindful of how she comes across to everybody else, because you do not want to be, like, if you're making the unit hostile, you need to be aware of that. So stop, take a breath. Also, the nurse that disappears a lot and leaving everybody else to do her kind of work. If patient need things, let her know. Say, hey, Ashley, if you leave the unit, let me know where you're going, just because something had been going on with your patient previously and we couldn't find you. Call a thing, you know, with that type of nurse. So the nurse bully, okay, so the nurse bully is a little bit nuanced, right? Because they're not doing anything that's necessarily breaking any policy or rules, but a nurse bully thrives in a negative environment. So if you entertain this, it will continue. For example, let's say you're on the unit with the nurse bully. Number one, start by demonstrating behavior that will just kind of dissolve that nurse bully mentality. Let's say somebody asks a kind of a, maybe a, not a silly question, but a very basic question, and instead of you degrading that nurse, give that nurse the answer. Give her the answer that he or she needs, that is not degrading, that is not diminishing. You know, that's going to change the climate in the whole unit. Also, let's say the nurse bully calls you to sit and manner or to bask in another nurse's error or another nurse's lack of knowledge. Don't indulge in it. I'm telling you, when that type of behavior is extinguished by the entire unit, they won't continue to do that. When they see that people are not going to dwell in or not going to indulge in that type of behavior, they'll stop, and that will change their behavior. So it starts with you. Don't indulge in it, and call that shit out when you see it. Call it out. Call a thing. So those type of people will not thrive in environments where that type of behavior is not encouraged, it's not tolerated, it's not exacerbated. When it's diminished right then and there, they'll stop. Or they'll just shut up. You know. So that's all, you guys. Those are some things you guys can do to deal with toxic nurses and nurse bullies. You guys follow me on Instagram at Adam Deshawn if you have not already done so. At the bottom, comment what are some things that you guys have done to deal with toxic nurses and nurse bullies. Please like and subscribe. Hit the notification bell so you will get notifications when I upload a video, and I'll see you guys in the next one. Happy nursing. Bye.